Hello, everyone. Thank you for joining us today for our discussion on hearing aids in Lenire. We have an hour with you, but depending on the time, we may be able to give you an opportunity to ask questions at the end of the session. And so wanted to let you know, just hold on to those questions at the end. If we don't get to those, you can always send those to us as well, and we'll give you more information on how to do that. So first, I just want to kick it off by introducing our guest speaker today, Dr. Emily McMahan. She is a doctor of audiology that specializes in the management of tinnitus. She is the owner of Alaska Hearing and Tinnitus Center in Anchorage, Alaska, but is also licensed in several states across the US. So some of her time, a lot of her time, is spent traveling to those different states, offering tinnitus education and management for those patients that are bothered by their tinnitus. And thank you so much, Emily, for joining us today and sharing information on the topic of tinnitus, hearing loss, and Lenire. We appreciate that.
Yes, thank you for having me.
Yeah, of course. And then I'll just quickly introduce myself. I am Dr. Tish Ramirez. I am an audiologist as well. I did practice in clinic early on in my career, but most recently and currently, I work for Neuromod, and I am responsible for the commercialization of this Lenire treatment device that we're going to be talking about today. Basically, just making sure all of our providers are specially trained providers like Dr. Emily McMahan do have everything they need to make the fittings of Lenire successful in their clinics. So here's what we're going to cover with you today. I'm going to talk about, Lenire. What is it? How does it work? I'm going to share with you our clinical trial results that have been taking place over the last several years, and also introduce some of the real world success that we've had with Lenire. Emily will be sharing her data that she's collected over the last couple of years that she has been offering this in her clinic. And then Emily's going to speak more specifically, to you, the patients that might be interested in seeking treatment for their bothersome tinnitus. She's going to talk about hearing loss and tinnitus. Are they the same? Are they different? How are they connected? Then she'll also talk about hearing aids and Lenire. And then we'll end with the key takeaways from today's webinar. So let's go ahead and get started. Some of you may already be familiar with Lenire. You may have been following us since we launched in the European market several years ago. We have now been available in the US for a couple of years now. Emily is one of our first providers that offer Lenire in her clinic. And we do have a nice provider network, and you can find those on our Lenire.com website. So for those of you that aren't familiar with Lenire, I do want to make sure that, I share with you, exactly what you're looking for in terms of what does this device entail? What does the treatment look like? And exactly how does it work? So first of all, Lenire is a clinically proven and FDA-approved tinnitus treatment device. It is the first and only device of its kind. In just a minute, I'm going to speak to the clinical research that did lead to this FDA approval. I'll share those results with you. So what makes up Lenire? Lenire consists of three components, if you will, of the device. So first we have a tongue tip. And that tongue tip, yes, it does go in the mouth, and there are some electrodes at the end of that tongue tip that offer a very mild electrical stimulation. I want to stress mild because, I know that's one of the biggest questions we get out there is, how strong is that sensation? Some of our providers describe it to patients as a similar sensation to maybe drinking a carbonated drink. And oftentimes for most patients, that sensation is even stronger. The carbonated drink is stronger than what you would feel with the tongue tip. The Lenire device also consists of headphones. They are Bluetooth headphones, and they are part of the Lenire treatment package. And finally, we have the controller. So the controller is what sends the signals both to the headphones and the tongue tip. And those two stimulations, audio and tongue tip stimulation, are what create that bimodal neuromodulation. So, meaning that there are two modes of stimulation that are working together to help with your tinnitus. And so, how does that work? So with the bimodal neuromodulation, as I mentioned before, you have an audio signal coming through the headphones, and the audio signal will be modified based off of your hearing thresholds. So some of you that do have bothersome tinnitus also may have some hearing loss, and we want to make sure that the audio settings are set just loud enough so that you can hear them comfortably. So that's one component. What we do know is that sound therapy has been around and used as a tinnitus management solution for many patients for many years. So we do know that that component does work. And so that's one element of our bimodal neuromodulation. But we pair that with a stimulation to the tongue. And as I mentioned, very mild electrical pulses are, presented to the tongue. And what that allows the brain to do is pay much more attention to the audio signal. So what you can think of is, yes, it's sound therapy, but when you pair it with something else, the brain's now fully paying attention. It's saying, okay, now there's something stimulating my tongue at the same time that I'm listening to something. So this sound must be very important. And what that does is it drives neuroplasticity in the brain. So what this allows for is the brain to adapt and pay attention to more sounds that are around you in your environment so that you're not as focused on the tinnitus sound. And so the bimodal neuromodulation does allow for that neuroplasticity to take effect in the brain. So having those two work together allow for some really great clinical results and real world results. So we see some great things happening out there and with patients that have used this treatment. And Emily's going to share some of this information in just a little bit. So what is the treatment plan? What we require, or what we recommend, is that you find a specially trained audiologist in your area. We do have all of our partners that are offering this in their clinics go through extensive training so that they are familiar with, how to manage the device when it's being fitted on their patients. So what you can expect is something similar to what you see on this screen. When you go into the specially trained providers, they will do a hearing and tinnitus assessment. So many of you may have already had some type of hearing test. So maybe you've seen an audiologist. You might be familiar with that process. It is similar. So you'll go in and see your audiologist. You will have your hearing tested because they need those hearing results to be able to program the device if you are a candidate for this device. In addition to that, part of the tinnitus assessment is a number of things. So your specially trained audiologist will likely send a survey to you to complete, asking you several questions about how bothersome your tinnitus is and how it impacts your day-to-day life. And based off of those results, it gives the provider a lot of information on what recommendation of management they should give to you along the way. So once that is completed, there will be a recommendation and a consult at that visit. And then if you are a candidate for this device, so there are some contraindications out there. Our device is indicated for persons that are 18 years of older and have moderate to severe tinnitus. But it is really important that you have that hearing and tinnitus assessment with your provider and talk through what you're looking for in terms of a tinnitus management plan. And Emily's going to talk a little bit about what she recommends and some of the conversations she has with her patients during this time. If you are a candidate, then the provider will schedule a device fitting for you. The device fitting basically allows you to get comfortable with how to use the device at home, because this is an at-home treatment. It's not something that you have to go back to the clinic to do. With the device, they will fit it in their office, and they will likely have you take some time aside and use the treatment for a few minutes just to make sure that everything is familiar with you. You know how to start the treatment. It does automatically stop for you. The at-home treatment, what you're looking at is a maximum of an hour a day. And you're going to do that every day because the brain likes something consistent. And for that neuroplasticity to take effect, it's important to be really compliant with your treatment. And that's something Emily will, again, talk about when she talks about the patients a little bit later on. So the at-home treatment is up to an hour a day. Most patients we're finding are doing a 30-minute session in the morning and a 30-minute session in the evening to kind of break it up. So, sometimes it's hard for people to find an hour a day. It's much easier to find 30 minutes. And quite frankly, for this type of treatment, it's really important to just take that time for yourself and step away from everything that, might be impacting your tinnitus from a day-to-day perspective. So it's really nice to be able to take that time for yourself. And then you'll schedule some follow-up visits with your provider. Depending on your provider, those follow-up visits may be in the office or they may be remote sessions with your provider to see how you were doing with the device. Of course, there will be some touch points along the way just to make sure from a functionality standpoint, things are working. However, when we're looking at how well you're doing with the treatment and looking at some of the outcomes that you might be getting and the results, it's important, that you take that time and use the device for many patients, what we're suggesting and recommending is that they're using the device every day for a minimum of 10 weeks before you start to see, those impacts and changes on your tinnitus. Some may start to see some changes and impact earlier. Some may take a little bit longer to see those and really feel that it's impacting, how bothered they are by their tinnitus. And then again, you'll just stay in contact with your provider and they'll set up that treatment plan that works for you. You may have other visits along the way, or, you may decide to set up a treatment plan and say, you know what, I'm good. I've used the device for, X number of weeks. I feel like I've achieved what I was looking for in terms of how to manage my tinnitus. And quite frankly, some patients like to be able to use this treatment as that opportunity to take that time for themselves and continue it along the way. This is why it's really important to work with a skilled provider such as, Dr. McMahan and all of our trained providers, because they know how to individualize that treatment plan for you. So let's talk about the clinical trial results. It's pretty impressive how many participants we've had across the different clinical trials over the last several years. And not only that, but we've had an opportunity to get the results and these trials published in some peer-reviewed journals as well, which is extremely important when we're looking at whether or not a device is safe and effective. So those are the things that we're looking at when we're setting up these clinical trials. So I'm just going to give you a brief overview of the three major clinical trials that we had for this Lenire device. Again, what we're looking at is, proving that safety and efficacy for the patients. And it's important that we're able to repeat these trials and see similar results. So yeah, we could have stopped with one clinical trial, but we didn't. We wanted to make sure that, we tested a couple of different things and saw, the same results so that you could trust in the treatment that's being offered to you. So our first trial, we had over 300 participants in this trial. It was a double-blind trial. And for these clinical trials, keep in mind, for a clinical trial, we have to have a start and an endpoint because we have to be able to collect data. Emily, in a little bit, is going to talk more about the real-world situations that she has with her patients. But when we look at clinical trials, there has to be a very specific protocol because we're testing very specific things. So the very first trial that we had, we were able to prove the safety and efficacy of bimodal neuromodulation over that 12-week period of time for these patients. They did have checkpoints. So we looked at results at 6 weeks and we looked at results at 12 weeks. And what we found is that, these patients were very satisfied with the outcomes in terms of how they were able to manage their tinnitus with bimodal treatment. Our second Tente trial, what we did here is we wanted to, just look at some of the settings in the device. So we wanted to see if, there was anything that we changed within the setting parameters, whether or not that still resulted in, some of the similar advantages for patients after using bimodal. And with the second trial, we had almost 200 participants. And so we were able to prove, similar to that first trial, the safety and efficacy of bimodal neuromodulation to manage tinnitus. Our third trial is, I would say, for the US is probably the most unique. The third trial is the one that led us to our de novo grant for the approval through the FDA. Simply what that means, de novo is the first of its kind to get approval from the FDA for this type of treatment for tinnitus. So with the Tente 3 trial, we had over 112 participants. And, there was a couple of unique things about this particular trial that I'm going to talk about. So for the Tente 3 clinical trial, one of the things that we did differently, and one of the things that was requested from us from the FDA was, to have more of a control. So the way we did that is the participants in this third trial for the first 6 weeks were provided with the sound only stimulation with our bimodal treatment. So for 6 weeks, it was sound only treatment. And then for the second 6 weeks, we incorporated that bimodal piece with the tongue tip stimulation. And what we found here, and basically the results with this Tente 3 trial, is that 62.9% of the participants who completed, remember that sound only piece, 62.9% of them also reported that they had additional benefit with bimodal. This is extremely important. If you think about any treatment plan for any ailment, that you might think of, if you're getting benefit from one type of treatment, to then go further and incorporate another element of that and see further improvements where we're looking at, 62.9% of these patients had that further improvement, that is really setting a high bar for, what we see in terms of tinnitus management. And as I mentioned early on in the session, is that sound only has been used for, quite a long time to manage treatment. And now we were able to prove with this Tente 3 study that when you incorporate that bimodal elements, that we have patients that further improve in terms of their tinnitus bother. One of the other things I'd like to point out is the compliance rate. We know, I mean, we're all human, we try to start a workout routine. It's the beginning of the year, right? We sign up for our gym membership and we're saying we're going every day. And we don't tend to be too compliant with that after 2 or 3 weeks, right? What we found consistently throughout all of the clinical trials is the compliance rate for the patients using the Lenire device was over 82%. And Emily can speak to this from a real world perspective because you may argue, well, this is a clinical trial. They may have felt like they needed to start and end the treatment. Yes, but we're seeing this exact same compliance in the real world as well. And Emily will share that information in just a little bit. One of the other important things that came out of the TENTE3 trial was the recommendation. So 88.6% of the patients said that they would recommend this treatment to other members. So other family members, people that they know, they would recommend this to treat tinnitus. And then 70.5% of those with moderate or worse tinnitus had a meaningful reduction in tinnitus severity with Lenire. And this is after having that insufficient clinical benefit from sound only. So again, as I mentioned earlier, with this has been indicated for those with moderate to severe tinnitus, indicated for patients over the age of 18. But again, you want to talk to your skilled professional about whether or not this is the right treatment for you. But those patients that went through the sound only that had more moderate and severe tinnitus, 70% of them reported a meaningful reduction in their tinnitus in that second 6 weeks. So those are some of the results that we have from our TENTE3 trial. One of the most important things, I think, as a consumer, as somebody who's looking for something in terms of a management strategy, is this safe, right? Is this effective? I already talked about a lot of our, clinical trial results, but also is it safe? So as I mentioned earlier, if you look at across all of the trials, we had 83% of these patients would recommend this to treat Lenire. So they would recommend Lenire to treat tinnitus. We had 7 out of 10 of the people with moderate or worse tinnitus had significant reduction after that sound only treatment. So they went through that sound only treatment, and then if they had moderate or severe tinnitus, they had a significant reduction implementing that bimodal component of their treatment. Is it safe? With all of the clinical trials across the board, there are 0 serious adverse events. So, this is something, as I mentioned earlier, I think one of the most interesting things to people when they're reading about this is that tongue tip stimulation. It's new, right? It's a novel treatment, but we have proven that it is safe. So let's transition a little bit to, let's transition to our real world evidence. We recently had our first retrospective real world analysis of US tinnitus patients. And these are Emily's patients that she's going to talk about. And the results that you're going to see in a little bit have been made available in medRxiv. It's an online preprint server for health sciences. But if you're really looking at digging into this a little bit deeper after the webinar, if you go to our website, lenire.com, if you go to our resources and then our blog section, you can find, this in-depth information. But with that, what I'd like to do is turn it over to Emily, and she can talk to her experiences from a real world perspective. So Emily, I'm going to turn it over to you.
All right. Thank you, Tish. So as Tish was just going through, for the purposes of what we're going to speak about today, this is that document that is available on the preprint server for those of you that would like more detailed information. But this is essentially a translational study, meaning we can compare real world patient outcomes in comparison to the TENTE3, which was the US FDA approved clinical trials. And so when we are looking at this from this angle, Just for the purposes of this, we are looking at 220 patients, and this was taken within the first 12 months. We are then able to look at kind of what those different outcomes are looking. So we've got a couple quick stats up here: male versus female, average mean age, average length of which they have been experiencing bothersome tinnitus. And then some of the really exciting portions of that is, once again, the compliancy was extremely high. So what Tish was explaining earlier is, in general, these patients have been very motivated, highly motivated to complete treatment, highly motivated to be compliant with the different recommendations. In my clinic, I do recommend the 2 30-minute sessions, much more than I recommend the 1 60-minute session. And that just has to do with the data of my patients were being more compliant, breaking it up into 2 sessions versus trying to find 60 minutes of dedicated Lenire time. And part of this was talked about earlier, and I had seen a few questions had come in saying, do I really need to do nothing? And Tish has mentioned, more than once of when you're sitting in those sessions. And we do recommend to just sit back and relax if you're able to do so. Sometimes we will come up with some light activities that might be coloring. It could be a puzzle, could be a word search, but we're not looking at doing anything that is mentally strenuous, because we want your brain to be able to focus on the 2 positive stimuli that we are providing you through the Lenire, one being the tongue tip, one being the sound through the headphones. The more activity and the more kind of extra things we're throwing in there just doesn't allow our brain and our body to be into that good relaxation session. And we want you to be able to gain as much benefit as you can. When we're looking at outcomes, one of the first things that you may have already noticed is that our outcome rate is more favorable than the 10-day-3 clinical trial. And the reason for this is, when we're looking at real world evidence, these are patients. These are my patients specifically, meaning I have a relationship with you. We are working together. We're having multiple touch points. If you're having a good day versus if you're having a hard day, you have a team, you have someone that you can call. We can walk through those fluctuations like the clinical trials. Because the clinical trials had to prove that the device all by itself with no intervention was successful and effective, which they did do 3 separate times. When we start moving into, though, with patient data on real world patients, you don't have to do this alone. It is an ongoing relationship with my patients. Then I am an audiologist, as Tish had shared earlier. And so we are finding across the board, not just in my clinic, but to my other colleagues of whom have significant data that we've been able to share, we are having a much higher success rate than the clinical trials. What that looks like is we've got 91.5 patients are reporting that they had significant reduction in their tinnitus's intrusiveness at the completion of their 12 weeks. We talk a lot about, but Tish mentioned it earlier, 12 weeks was the clinical trial data, and it was the best information that we had to run with. I can tell you that in the real world, there are patients that I recommend we go beyond. For some, it might just be 12 weeks. In 12 weeks, we are still achieving these very favorable outcome numbers, but 12 weeks isn't always the end time. Unlike the clinical trials, where that was both a start and a hard stop, in real world patients, some of you might use it continually. Some of you may switch to intermittently, in which in my clinic we call maintenance mode. We maintain other aspects of our life, and so we kind of add tinnitus into our maintenance mode. And then even more excitingly, I think, than the 91.5% of success is that 89.2% of those patients verbally said, yes, this was a successful treatment for me. And while I say that's as exciting as that means that many 90% of patients are not just agreeing with the data, but they're able to express that this was a positive treatment plan for them. So often following multiple versions of treatments that they've tried over the years that they had not found the same level of success with. And so I think it's really important when we're looking at this to be able to talk about those numbers, just because this is, as Tish said, a novel approach within the US specifically for this conversation, but it's been working repetitively in real life patients, which are not clean and very perfectly compliant like in clinical trial patients.
Perfect. Thank you, Emily. What I'd like to do now, and again, this is really fantastic information. And what you'll see with these particular patients that Emily just spoke to, what we're looking at is they wanted to compare it directly to our clinical trials, right? And so to be able to have some data, as Emily mentioned, the one piece that is different is in the real world, you have a provider like Emily supporting you along your treatment. And so that's why these results are so fantastic. It's so great to see that you've helped so many people, Emily. What I'd like to do is, I do have a question for you, Emily, and I know this has
Sure.
come up a lot with patients, is tinnitus related to hearing loss? Do I have tinnitus because of hearing loss? Are they the same, different? Can you talk a little bit to this?
Sure. So you can have hearing loss and you can have tinnitus and you can have hearing loss and tinnitus, but they are not one and the same. And I think that needs to be said not just to you all in listening, but to my colleagues across the board, whether that be an ear, nose, and throat physician of where you have potentially sought care, whether that be an audiologist where you have sought care, because as so many of you are typing in the chat, they just wanted to sell me hearing aids. They only offered me hearing aids. No one gave me other options or solutions and told me this was my only choice, if they even provided you that choice. And I would assume that many, if not most of you, are nodding along in agreement because that's such a common story. And I think what has been so telling in the last 2 years now, because the first patients were fit in the United States in May of 2023. So we're quickly approaching that 2 year time frame. And I think when I've shared with my other colleagues, especially those early on providers, we were so ingrained and taught that hearing loss and tinnitus are best friends, and they are not. And so part of what I want to talk about tonight, what we wanted to bring to you is, why would we maybe choose hearing aids? Why would we choose both? Why would we just choose Lenire? And why all of them can be appropriate options depending on what your individual needs are and where you're coming into this conversation from, because you may have already done a combination of those attempts, or maybe you're successfully using some devices. And so what we have kind of on the graph here is our brain, but more specifically, we're looking at the auditory cortex, or how our ears relay sound from the outside to the middle, up to the inside, and to our auditory cortex, which is our brain's listening center. And so that is a really clearly defined path that there's little to no argument about, to be fair, from the hearing side of the world. And what we know is that as we use sound and sound therapy, that's how we became so tied to the ears. The second reason we became so tied to the ears is the moniker of what we call tinnitus, which is ringing in the ears. If I could rename something, and this will upset someone out there, it would be to stop calling it ringing in the ears, because we have moved so far away from the ears, and we know that this is happening in the brain. But we perceive sound and we perceive listening and things that we experience as a sound, which is appropriate. We hear through sound. And so it just became nicknamed ringing in the ears. And for so many years, we blamed the ears, which is how hearing loss and tinnitus became friends. Even prior to the last 2 years, but especially in the last 2 years, we have not only then been able to start to see the difference between, it's not just hearing loss, it's not just the ears, because we have really good data, some of which you're going to see here in a little bit, that talks about just treating the tinnitus to treat the tinnitus, irrespective of your ears. And so what I mean by that is, I have treated patients with Lenire of whom have hearing loss and of whom wear corrective amplification, and they have been successful. I have treated patients with Lenire of whom have hearing loss, and they have chosen to not correct it. And guess what? They have been just as effectively treated with the Lenire when we're looking at their tinnitus, because tinnitus is itself, and it doesn't have to be brought into hearing loss. You can have both. You can have one or the other, but there are options, and we need to start being able to look at them as individuals rather than always forcing a relationship to the hearing system when maybe you don't want that. Maybe you are not ready. Maybe you've had unfavorable success and you're just not comfortable going down that route again. That is okay. It doesn't negate the hearing loss, but it doesn't negate that you can receive tinnitus specific treatment for your tinnitus. And I hope for those of you that are joining us that I know based on some comments are maybe feeling that way, I hope that after this you feel empowered enough to be able to make that call or send an email or say, you know what, I'm really interested in tinnitus specific treatment. And so what we see on the slide here is, should it all be treated the same? No, because not one of you are the same. So why would we possibly have a cookie cutter approach to managing your healthcare and managing your individual needs? We shouldn't. And if they do, get a second opinion. There are options for hearing aids, and hearing aids can be effective for someone with both hearing loss and with tinnitus. I use hearing aids in my own private practice, so I'm certainly not saying that there's not a time and a place for amplification, because there absolutely is. Also, counseling is an extremely effective tool. If you've never been with an audiologist or potentially an ear, nose, and throat physician who is more inclined to discuss tinnitus than less inclined, when they have the right and factual information, you just might need really good counseling and a connection to help understand what's happening. And that might be all you need for your brain to say, oh, hey, all right, this really isn't that bothersome to me anymore, because we've taken away the fear or the worry or the scare factor that comes into not understanding what's going on with your body and in the situation specifically to your tinnitus. TRT is another treatment option, so that's tinnitus retraining therapy. That is going to be using low-level noise in addition to a very regimented habituation program that also has really good success rates. And sometimes you may have tried 1, 2, or 3. Maybe you've tried all of them. And then most recently added to the table appropriately then is the Lenire device. And that's going to be, as Tish said earlier, combining low-level electrical stimulation along with the tongue or along with the sound. And those are in sync, which is giving your brain this really enriched messaging and helping the brain to be able to move past that cycle that it gets stuck on with our tinnitus. So we hear it, then we want to figure it out. Now we want to stop hearing it, and we just can't quit focusing on it. And unfortunately, what often happens is that focus just builds and builds and builds. And that's where we start seeing people having significant debilitation from it, because it's really hard for their brain to allow their brain not to focus on the tinnitus itself. And so when you're looking at an individual, when you're working with a provider, you want to make sure that they have kind of a well-rounded repertoire. And so that's something that's been really nice with Lenire, is that in addition to training patients on their device, they've made sure to intentionally choose providers across the country that already had a working knowledge of tinnitus and already had these options available. And then they're just adding the Lenire option into their clinic. And so learning any device is never the difficult portion, but making sure that that provider has a well-rounded approach to be able to manage both easy tinnitus cases as well as the most difficult tinnitus cases is going to be really important, and really tying back to that counseling portion. So how do you know what you should do? To be fair, that's not my place any more than it is another provider's place to tell you what you need. But what we can do is give you good information, give you education, and help give you the data that you need to be able to make a good decision for your hearing healthcare or your tinnitus healthcare. So one of the questions we have on this flow chart that I think is handy, and if it sounds good to you, maybe jot some notes down, but is it tinnitus or hearing loss that's driving you into the office that you're there? If it's hearing loss, then absolutely, it is completely appropriate for your provider to focus on hearing and hearing management, because the number one reason of which you were seeking care was for your hearing loss. And there's nothing wrong if that's where your primary concern is the hearing loss. And maybe, yes, I have tinnitus, but it's not so bothersome. Hearing aids are an entirely appropriate option for you. If your reason for going into their office was your tinnitus, then we've got to kind of get more into that. If a hearing loss was discovered, are you open to learning about amplification and then what tinnitus options are? Or is that something that's just got you very uncomfortable and you really don't think that you're ready to have the discussion about your hearing loss and you really just want to focus on tinnitus? That's absolutely okay. We can do that too. There is going to be some candidacy coming into play. We do need to make sure that you're a candidate for Lenire, no different than making sure you're a candidate for any other medical devices and or treatments that you would be seeking. So we do need to make sure that you meet candidacy. If you don't meet candidacy, we might request that you receive medical clearance. If you're able to receive medical clearance, then you are now able to be a candidate. If you're not able to receive medical clearance, that's where, similar to that previous slide, there are other methods and options of which we can work with patients who may or may not be candidates for Lenire. But thankfully, the majority of patients do meet criteria candidacy for Lenire. I believe it's about 80, I think it's 86% in my clinic is the clearance rate for they wanted Lenire and they met candidacy and they were able to move forward if they chose to. So it's 86% is my clinic status. So we're not having a large portion of people seeking Lenire and being told they can't receive Lenire, but that certainly doesn't undermine the frustration if you are one of those smaller patient populations of who can't move forward with that treatment. If you are a candidate, and like I said, thankfully the majority of patients are, then what is going to most likely happen is you're going to go over goals and expectations with your provider to make sure that we're on the same page for how Lenire is a positive tool and how we're going to work that tool into your day-to-day life. 60 minutes may not sound like a lot of time, but it is the number one thing that people come back to me the first couple of days and go, holy cow, I did not know how hard it was going to be to find that much time in your day. And so while it does seem like just an hour, it is important to have that compliancy, to have that good repetition, and to give your brain all of that positive information. Once you pick the decision to move forward, you'll get scheduled for a fitting. Like Tish said earlier, there is some programming that goes into it. So your provider is going to use your hearing test because we do program the hearing thresholds into the headphones. We also then need you and your tongue to do a calibration for the tongue tip. And then I would assume all, but I would hope all. If not, you're going to do a little listening session in the office. It's not normally the whole 30 minutes, but the reason I like to do that is, one, I want to make sure that you are entirely comfortable and that you don't have to be alone to experience something for the first time that is a little bit unusual. Most of us have never put a tongue tip on our tongue before and have no idea what to expect. It is very low level. It is not meant to be intense. It is not meant to be strong. It is meant to be a very soft stimulation. At some points in the treatment, it is going to be hardly even able to be distinguished because it will increase and decrease based on the sounds that you are receiving. After that process, you learn how to use it and kind of off you go, because like Tish was talking about earlier, this is predominantly an at-home treatment device. Your provider will have multiple touch points with you. Most commonly, that's going to be consultation, fitting, 2-week post-fitting, 6-week post-fitting, and 12-week post-fitting. And then farther out, depending upon how you're doing, if you're continuing, what all is left as part of that. At any point in time in this journey that you're like, oh, maybe I do want some hearing help, you can absolutely move forward and get hearing aids. If you've already been using hearing aids and you're like, oh, but I'm already doing what I was told. Okay, that is true. But 2 years ago, we finally had the ability to bring this technology into the United States. And so while you are not wrong that 2+ years ago, hearing aids were the main and number one source for tinnitus management, we have more options now. And the cool thing is our patients that were already wearing amplification and then added Lenire in still found the same level of success as patients who had never done any type of auditory stimulation before. And so whether hearing aids are already in your hearing and tinnitus journey or they're not yet in your hearing and tinnitus journey, both of those are really excellent options. It's just going to depend, where am I starting and what most needs do I need to have met so that I can be successful in my tinnitus and or my hearing loss journey. So we're going to look at some of this data specific to hearing aid users and specific to non-hearing aid users to just make this a little bit more realistic for you all. Perfect. So out of 214 patients, of whom all had reported bothersome tinnitus, 88 of them were hearing aid users at the time of getting fit with their Lenire, which then leaves 126 of them of whom were not wearing hearing aids. And as I shared earlier, my office does 2, 6, and 12-week follow-ups. And so we did different touch points with them throughout this. And then important things to note, hearing aids are out during your linear listening sessions because we're programming the headphones based on your hearing thresholds, which means we are correcting for any hearing loss that you may have already once those headphones go on. So we don't need to have the hearing aids on in addition to the treatment. You go ahead and go to the next slide. And so here, once again, so on the left-hand side, to stay consistent, these are our patients that wear hearing aids. And on the right-hand side, these are our patients without hearing aids. 92% of patients who were fit with the Lenire and already wearing appropriately amplified hearing aids, 92% of them found that adding Lenire into their tinnitus journey was beneficial to them. That is incredible. 86% of patients of whom have not addressed their hearing loss, 86% of patients reported that Lenire was successful and beneficial in their tinnitus journey. And so while yes, 92 to 86 is not identical, those are within kind of like reliability outcomes. And so there was not one answer that said you have to treat your hearing loss before working on your tinnitus, or you have to do Lenire before hearing aids. These outcomes are so similar enough that it really puts it back into your court of what are you having difficulty with? How are we able to best support you in this journey? And as we're going through this tinnitus journey, there were patients that at the completion of this said, you know what? I think I am ready to get hearing aids now that we've really tackled my tinnitus. I'm feeling a lot better about this. I'm more comfortable with everything. And then let's move forward on the other side. So there's not a wrong answer when it's coming down. And this is what I think is so important, because so many of you have already reported in chat today that I sought help. They told me there weren't any options other than my hearing aids. Another thing that also could influence the recommendations that you were provided is the particular office that you went just might not be a tinnitus office. And that's okay too, because not everyone specializes in tinnitus. And so if you are in an office that tinnitus is not their focus, they may or may not even be aware of the Lenire as a tinnitus treatment option. They also just might not have the information to give you an educated recommendation of how even to know about Lenire or where to find Lenire, or even know to refer you to someone of whom has access to this tool. So someone not recommending it doesn't necessarily not mean that you weren't available or a good candidate for it. More likely than not, given the number of Lenire providers in the US to non-Lenire providers, your provider just probably didn't know the information to be able to give you that level of a recommendation. So if you have found yourself to be in that position, that also is worth then a visit to the website, where you can then find of whom would you be able to. Tish mentioned it earlier, I'm licensed in 15 states, so I kind of bebop all over. So if I happen to be one of those states, please reach out. We're also happy to help. And if I'm not in one of those states, I also know all of the Lenire providers. So between the Lenire team, between my team, we're also happy to help you find a provider that's close to you that has us as an option, because we really just want patients of whom feel that this could be beneficial to be able to get into that office where they have a knowledgeable provider and be able to get started on their journey if this is something that could be helpful for you. We want to go to that next slide. So when we're looking at this tonight, between Tish going through kind of what is Lenire, what are the different parts and pieces, explaining the history, because most of the history of Lenire is outside of the United States. Hopefully that gives you some good information. If you're someone who is kind of struggle with that amplification versus not, do I focus on tinnitus versus not? I hope that this alleviates a little bit of that angst that may have come into this conversation, and know that both are great options, and sometimes both are the best choice. Sometimes one is the correct choice at the time. And that I think it's exciting that this was able to prove for patients that were already actively ongoing tinnitus management, adding an additional tinnitus management tool didn't give them no additional information, it then went on to provide them exceedingly more beneficial tinnitus treatment. And so that's so exciting because we've all done things before and maybe they worked and maybe they didn't. But it's nice to know that in this situation, we can add Lenire into wherever you are at in your clinical journey if you're a candidate. And then we were still continuing to find that meaningful success, which is just so empowering as a provider. It's so exciting to be able to talk to patients and say, I know there's a lot of unlearning to do, or I know you've got 30, 10, 15, however many years of tinnitus, and every time you sought help, someone told you there was no option. That is no longer the case. Very confidently, we can say that is no longer the case. And if you don't feel like your needs are being met at where you've received care or offices of whom are near you, it may just be that a tinnitus specific specialty clinic is not super close, which, yes, is frustrating. I live in Alaska. I understand more than so many people about not receiving care close to home. There are lots of providers across the country that hopefully are close enough to be able to help you if this is a direction that you choose to go. So thank you so much for allowing me to share that with you. And hopefully that was helpful.
Thank you so much, Emily. This is really fantastic information. And just as Emily mentioned, we do have providers across the country that have been trained to fit Lenire. And all of our providers are tinnitus specialists. So we wanted to make sure that they did have a strong background in tinnitus. If you go to our website, lenire.com, and you click on Find a Clinic, you will be prompted to complete a form. And if you submit that form, we will connect you with the closest the professional closest to you. And so I recommend you go to our website if you're interested in Lenire. We do have a few minutes to address some of the questions. As I mentioned earlier, if we had some time, we would do this, and we do. Keep in mind that there were hundreds of questions that came through. And what we did is we took a look at what were some of the common themes in some of the questions. And some of these are going to be addressed directly to you, Emily, as the clinician. One of the questions is, what if my tinnitus fluctuates during treatments? I know that that is a big concern for many of those that are bothered by their tinnitus, is that fluctuation aspect. So can you address that?
Sure. Fluctuations are very normal. In fact, I would say it's less normal if you said your tinnitus never fluctuated in how you experience it. Couple of different things. There are some adjustive protocols that we can work with, especially if you have a lot of hesitancy in the initiation portion of it to help manage the fluctuations. And then also sometimes just taking away the fear of what a fluctuation is. So if we don't talk about tinnitus for a minute, but maybe we just talk about how we feel for the day. There will be points in our day we feel really great. There will be points in our day where we are dragging. Maybe it's time for a little brain break. We need to walk away. And we can see kind of just how our life and affect around us have fluctuations throughout the day. That's not necessarily good and it's not necessarily bad. But when we're looking at fluctuations with tinnitus, we want to have a really good conversation and see if we can identify what potentially is a triggering point for your tinnitus fluctuations, and then work on how do we relieve them and then help to soften them. I will say many patients of whom experience tinnitus fluctuations have less significant fluctuations after using Lenire. They still have fluctuations. I'm not saying that that is what the change is, but they don't necessarily go from like 0 to 100. Maybe we have smaller fluctuations because they have a quick way of being able to manage it and be able to come down from that fluctuation much quicker. But that is definitely, it is real. Most patients experience fluctuations, but we have lots of tools and kind of tricks that we can do to work with you through those.
Thank you for that, Emily. Another question has to do with the type of tinnitus. So there were some questions around musical tinnitus, and if you've treated any patients with musical tinnitus with this.
Sure. So I have had a couple. That is going to be a much smaller subset of patients. So I cannot at this live moment give you specific data off the top of my head like I can with our real world evidence. There's also another provider that does a lot in the music industry, and I know he's also fit a few patients with that. When we're looking at tinnitus, and we're looking at tinnitus that is not from a physiological disruption or an injury or something like that. So we're just looking when we're just looking at just kind of the usual route of tinnitus, what we have to figure out is how do we unlock your brain's emotional response to that? Because we know that most Americans have all experienced tinnitus. We also know that the majority of people of whom experience tinnitus classify it as non-bothersome. But when we're working with this patient population of whom experience bothersome tinnitus, it's generally less about how you experience it, meaning how does it sound? Is it waves, ocean, ringing, buzzing, chirping, even musical, and more about how do we help the brain move around that experience of your tinnitus. And that's where Lenire is the tool in this situation that we're using to help the brain form new response patterns rather than responding to the tinnitus and how it is originating in your individual situation. So yes is a quick blanket answer, but naturally that would be really good conversation to get a little bit more into the depth with individual providers.
Thank you, Emily. Also, a couple of questions about candidacy.
Sure.
One more specifically about, if they have hearing impairment in just one ear. And then another question, if you can share again your stats on, the percentage of patients that have come through your clinic that weren't candidates.
Yeah, so of patients who come to me seeking access to Lenire, I believe it is at about 86% of them that come to me and want it, and I'm able to clear them for using the device. So thankfully, the majority of patients are able to receive the device and they're not excluded based on criterion. Now, to answer the unilateral question, so somebody may have significant hearing loss in one ear or maybe a dead ear. I have fit and do routinely fit patients of whom their one ear is within the candidacy criterion and their other ear is not in the candidacy criterion. And you're going to say, but my tinnitus is in the ear that I don't hear well. And I'm going to say, I agree with you and I hear you. But the cool thing is because we're stimulating the brain, your brain doesn't care which ear I use. My preference is always to use both ears when both ears are available. However, when we can have one ear be a great candidate from an audiological profile, I can still send all of that good sound and you're still getting the tongue tip stimulation. And we're finding those patients to fall into the same outcome levels so that 91.5% of patients, that included many unilateral patients. And so, yes, I absolutely do and can. We do need at least one ear, though, to be well within the candidacy for the hearing side of that picture.
Great. Thank you, Emily. Again, I wish we can address all the questions that have come through. A lot of questions. We appreciate the interest. And again, you can reach out to us on our website if you have more questions. Please, if you're interested in, managing your tinnitus with Lenire, you can go to our website as well and seek a provider. Emily, thank you again for sharing all of this fantastic information. I'm sure the patients out there appreciate this. Hearing, from a clinician about their success using Lenire in their clinic. So we appreciate you joining us today. Thank you so much. Thank you all for your time today. Again, reach out if you have additional questions. Have a fantastic evening.
Good night.